but can you expand on some of the best practices you see in call centers and the types of changes that have had an impact?
Call centers, for the most part, they're notorious for an incredible employee turnover rate. And 30, 40+% turnover rate in a call center is not unusual. Needless to say, that doesn't help anybody because you've got the cost of training, right? The cost of lost patients. I mean, the impact of that financially to a good-sized practice can be really significant. So over the years, one of the things we've done in working with call centers, and it just so happens we've done a lot of work internationally with call centers as well. And one of the things that we see is the lack of clarity in a call center as to who should do what. You need to split up the call center. And it starts right with the IVR, the integrated voice response system that they've got that sits on top of the call center, right? When you call us, I mean, just think about it yourself. You call a call center and you get 9 options.
Yeah.
By the 4th one, I'm ready to jump off a cliff. So once again, coming back to it with a call center, best practice, 3 options. Existing patient is 1. New patient is number 2. Medical questions, prescription refills, things like that, 3. Right? If you're an existing patient, boom, it's going to go to customer service. So you've got a select group within your call center that are customer service agents. That will be your biggest number of calls. The reality is that group, generally speaking, can do the least amount of harm. They shouldn't be talking about clinical at all. The second group, the sales group, for all intents and purposes, the education group, they need to be super skilled, right? By super skilling them with the right way, with the right talk tracks, right? All of a sudden, your conversion rates, right, go up, and they can go up dramatically. And what is the third group is really kind of the medical team. They're really understanding of, right, how things work, how to get prescriptions refilled. They've got backlines directly to doctors and clinics for answers for questions, which needs to take place immediately. The best route is a backline. So when you put all that together, all of a sudden you've got segregation of duties in the call centers that can be incredibly helpful, right? As far as people understanding the job, knowing their task, right? And of course, capturing all the right data.